Hello and welcome to the Legal Epidemiology Satellite Conference, part of the Law Enforcement and Public Health 2021 virtual conference in Philadelphia and cyberspace. We're happy to have you join us. I'm Scott Burris, a professor at Temple University Beasley School of Law and one of the conveners of this satellite. And I want to tell you just briefly what we're all about in this meeting. The aim of our conference is to be a bit of a bridge builder. We want to bring together people who are interested in health and health outcomes, but who are not necessarily that keen on including law as one of the things they study. We also want to bring in people who are adept at studying law and legal systems and law enforcement, but may not be used to thinking about health as one of the important products of those systems. Our epidemiological case here is pretty straightforward. Fundamentally, law is driven by social position, by the resources you have access to as a human being in your social milieu. And that social position is transformed over the life course into your lifespan and your life's health. And law plays an important role in both of those. Law is law is a number of different kinds of processes and experiences that people can go through that will sort them from a starting position in society to health outcome. We know, for example, that incarceration is not good for your health, and we don't randomly incarcerate people. We tend to be more likely to incarcerate people whose social position has been defined by their race or their economic level. In fact, there are a lot of ways in which the legal system, a lot of different elements of the legal system and criminal justice that does this sorting work, and that's something that needs to be studied, understood, and changed. But more fundamentally, law is a contributor to the underlying social conditions that determine people's social place. So, for example, our tax laws have a big impact on the distribution of wealth and income among our population. And to the fact that we see drastically rising inequality over the last 30 or 40 years. And we know a lot about law and its health effects and its utility as a way of changing unhealthy conditions because we have great science that has shown us that. But unfortunately, we have great science in certain limited silos, and there are lots of areas of law, including, I think, the area of criminal justice, public health law, that have not been sufficiently studied. We want to know more because law is a big factor. As I said, it's something that we see getting adopted to solve problems all the time. These are adoption curves of various kinds of public health law interventions, and you can see how rapidly they rise across states. So very quickly, all state legislators will get the idea that we ought to, say, have a youth sport concussion law, and they'll adopt them across the 50 states in rapid time, well before we know whether they actually work or not. The result is that of lack of attention by researchers to these problems is that sometimes we have laws that are meant to be solutions and are claimed to be solutions, like the current drug policy regime, which actually don't do what they're supposed to do. We don't actually have success in the control of illegal drug use through criminal law. And yet we don't have a lot of evidence that makes that a compelling and salient point in drug policy debate, or at least not until recently. And of course, law may also be doing bad. So our drug laws don't really control drug use, but the enforcement of our drug laws have a lot of iatrogenic effects. They cause harm, as we discussed in this particular paper years ago. So it all comes down to one analogy, right? I mean, at the moment, we don't know for the most part whether our laws are working or not in terms of having positive health effects. We don't know if they're having side effects that are unhealthy. In fact, we often don't even know where the law is being applied and where it's not. And all you have to do is think of law as a treatment, like a pharmaceutical product. We obviously can't usually test law in advance through sort of clinical trials, but we can certainly jump on law as soon as it's enacted and start to investigate pretty rigorously what effects it's having. And if we realize that laws are treatments, and if there are treatments we are applying to tens or hundreds of millions of people at a time, the ridiculousness of not doing more of this work the madness of it becomes, I think, absolutely clear. And so it's the importance of the kind of work that we're going to see canvassed in this conference. We call this kind of work legal epidemiology. 12 years ago, a group of us were funded by the Robert Wood Johnson Foundation to try and highlight and bring attention and maybe bring some solutions to the problem of insufficient evaluation of law. And the first thing we did was name the field to be able to highlight what was missing. But the important thing for all of you joining us is that we are not suggesting that your work as a psychologist or an economist or an anthropologist or an epidemiologist is somehow irrelevant here. It's absolutely to the contrary. Our point is that legal evaluation is just normal science. You can understand the effect of a law on behavior using social psychological theory or economic theory. You can understand how people respond to a health order in the same way that you look at how they respond to a, any other kind of criminal justice order using standard criminological tools. The point is not so much that this is a field of new methods and new tools. It's that it is a field in which your existing tools and methods are much needed to help shed light on a certain kind of phenomenon. I will put in a plug for one of the few things we've done that is a bit more new in public health law research, and that's what we call policy surveillance, the ongoing systematic collection and analysis of laws of public health importance. This is the part that addresses the problem that we often don't know who's even being exposed to laws or exactly what kind of law they're being exposed to. And it addresses the fact that even where there is an effort to link laws to health outcomes, too often the kind of scrutiny that's paid to the quality of health outcome data is not paid to the quality of legal data. So people who will work for months paneling carefully selected health care outcome data for a study will just grab a few lines of text from somebody's website or a PDF and call that their legal variable. So we have worked very hard to improve the standard of measurement of law, essentially to develop systems, both methods and software tools to efficiently translate the words of law into numeric data. And part of our legal epidemiology movement is encouraging the production and access to this kind of legal data on an open source basis. So the granddaddy of these kinds of sources is the Alcohol Policy Information System, which has something like 20 or 25 policies that it follows, including now medical marijuana policies. And you can just go there, click, and download the data. Likewise, our team has produced the Prescription Drug Abuse Policy System for NIDA, which has some of the same cannabis policies and a lot of other opioid-related policies, again, available with protocol and code book for just a couple of clicks. And there's also our flagship open source legal data page, Law Atlas, where we have even more data that you can explore and use, which is transparent and very carefully built, often longitudinal to the 20 or 30 years. So we want you to enjoy this conference. And after the conference, we want you to keep in touch with us and take advantage of some of the services and networks that we have to help people do this kind of research on the health effects of laws and legal practices. Before I go and send you off to all the interesting sessions we're hosting, I want to thank some key people. Our provost at Temple, Joanne Epps, has been a stalwart supporter from the start of the LEAP conference and of this satellite. Our Temple Law School video production team has helped us produce all the videos you're going to be seeing over the course of this satellite. And the person in charge of all of this has been our communications director, Bethany Saxon. I also want to thank the National Science Foundation for supporting this conference. And finally, my co-conveners, Rosemary Faso and Jennifer Wood, who have helped us plan this at every phase and join me in welcoming you to what we hope will be an interesting experience over the next couple of weeks of Zooming. So take care, wear a mask, and we look forward to meeting you in person someday.